certification from World Health Organization, the WHO.
These are not necessarily people looking for us. Say last year, Yaba Nana Otumfuo and you be deemed for Mokakra. Common idea, Yena, we better say benefits Kakra. AMU, first one, your regional medical stores, the who are Shanty region, the BI is stored in Truno. Our regional medical stores in 1972. Now, if you more cry and warm, that's our time, Ashanti region, a population of 1 million. And I want to cry in True. See, Ashanti region, a population of about 5,600,000. Sir, Juana, you see, as a species no cry, no, I a problem, and rather call. Into your bed, Papa, so as Otumfuo say, you expanded regional medical stores. Young Potier drew and bra a Hawaii. Into a Juma a party, a demo acting a medicine, giving a speech at Pima and Kababwa. Now you challenge with transform power. Na ECG and a VR on my boy, Amena, a big transformer from Accra, 330 and a idea, Otumfuo so Yenya. An idea about Poswa Netos back with the oxygen plant. COVID-19 by I didn't come microphobic repair and from oxygen. UNICEF FY, Otumfuo, I'm a EC plant, more than $500,000. Now, the reason why I need to be used is any power. Power not connected to Otumfuo Hospital. All the power in Mars are oxygen plant and power in our form. And also energy through Otumfuo for every kind of system. And you see, not transform and require almost 30 transformer. Inti by my home pre-crab by now to me, we are a transformer. Ye piano, send you Otumfuo my party, say the invitation, and for no piano, ama. I dear Barco said, Tosso Barco, I die by a car, a mammy for Moko Wa or Moo. And it's you 2 fools, I say, a day and ye a farm. Now, your what's not saying for the whole last year, yet should move it, any confirmation, any check, any private, any public, true Ministry of Health, and Ghana Health Service. Yahu, Gintia, Yamano, Omoko, also. It's your document. Ama ye di Otumfuo ye hu se ade ba ko pa na e hayen eye wo hye doctors a o ma bi mu pa wo Ashanti region o mu na o konfa no chi na wo ko e kire nyina na ase na amode ne so e wo fom nti broni me potoka kra o se bi the clinical mentorship strategy se ni betimi ama a doctor for from konfa no chi o ma ko adura o ma ko tepa o ma ko mampo no ma boa na sesa ma na omko wusunu a omu frɛ omu ma ene omu susu sisa documents we nyina ebija ama Otumfuo na sese we no na WHO susu omu bua Ghana ene Ashanti region mami what you represented the whole Ghana WHO for the whole Ghana. Enti meka no ma ba ko yi no mo yama Ashanti region na nka mama no so akasa kakra. Ye kai COVID-19, ye kai cholera, and they say Ebola. Sa yare ni na ba emrepi no ye te hospital asana yare no aba. Ni ye hu se sa yare or community. But through WHO on boy ama iskam ya training 11 districts. Ye free BB event-based surveillance. To say, inti amafo empatemu and more community, no munya yaribia, or mutini catcher, Tian more hospital, Tisia Yaka and rabble some chick, or cramai a car, obi. In car and yet event be surveillance, amani a boy, MEA, in Kiantin and pay. Tiati, the back of fat penny, ya one panye, Una release the said Yakano, in Tia or more boy, MEA. Human papillomavirus vaccination, the day a cram at all, a ma awodiano or ma boy education, HIV, TB, and no ma be WHO or ma boy pa MEA. Mama, Mammy, I can say, I hear about about Otumfuo, a kind say, yeah, building facilities across Ashanti now. I'm being more specialist. I can say, Tepa Hospital, on share urology, baby, a Johnson, a farm problem or you could see you can say, from an hospital, every year dedicated to Mammy, for any crap, you could see any cancer Konongo hospital, any Kumu, a trauma. Any emergency services. There is strategic plan BBA. I can't say ever finalize it. You really now you ever back Otumfuo, no Otumfuo, am I blessings. Now you're twice into your buyer, you're not to see me.
Your Royal Highness Otumfuo Nana Hussein II, and the distinguished traditional leaders, I greet you respectfully and want to appreciate this profound honor to be able to pay this courtesy visit to you. On behalf of the World Health Organization, I would like to acknowledge the immense contribution and the role of the Otumfuo Foundation as a significant contributor to education, to entrepreneurship for the youth, to water and sanitation, and to health, as well as many other contributions that you are making. Your Royal Highness, through the Otumfuo II Foundation, the King, you have transformed healthcare across not only the Ashanti Kingdom, but beyond to the rest of Ghana, through refurbishments of hospitals, through maternal and child health outreaches, and donations of life-saving equipment. As the government does the implementation and of programs, Your Majesty provides the trust that is extremely necessary for the success of any program, including health programs. Because when you speak on matters related to health, the people listen. And so we want to acknowledge the significant contribution that you make to the success of health in this nation. We want to recall the example by the King in 2021 during the COVID-19 pandemic as the first person in the Ashanti region to receive the COVID-19 vaccine, and that inspired millions of people because of the trust that they have in you, that it's, once you approve, it must be safe and it must be good for the people. We, as the World Health Organization, are mandated as the lead technical agency on all matters related to health. And we promote universal health coverage for everyone. Every Ghanaian, wherever they are, must have access to health, must have access to quality health services. We support strengthening of the health systems that are needed to bring these services to people. We support control of diseases, infectious diseases, communicable and non-communicable diseases. And we also support efforts to ensure that there is health security for our people. We are here to express our support. We are here to continue to advocate for health and also to bring a message of encouragement and support, because from what we see, progress has been made, but we also still have some challenges which we would like to draw to your attention, Your Royal Highness. We are seeing the maternal mortality in Ghana as one of the concerns. We are making progress, but it's a bit slower compared to the other health indicators. So more mothers are dying than we should, and we need to see how to address that. We also still have the problem of HIV, AIDS, that is still, even though the incidence is low, we still have many people that are affected by HIV. And so today, Your Royal Highness, we are coming with 3 asks for your consideration. Number 1 is to leverage your support to advocate with traditional leaders on how to engage communities to address maternal deaths. And we are looking at encouraging early registration for antenatal care, so while mothers are pregnant, to seek care so that they are monitored and checked, and if there are any problems, that these should be detected early, and that they should be encouraged to address those issues. We also want the traditional institutions to promote institutional deliveries and also promote blood donations, so that mothers who are affected because of the risks around pregnancy, that when they need the blood, should they need surgery, that enough blood is available. So we seek your interventions on that. We also would like to have men more involved in supporting the women while they are pregnant and while they are delivering, and also in contraceptive use. All this is to support adolescents, women, in ensuring that we have better outcomes in terms of maternal mortality. Our second request, Your Royal Highness, is around the stigma related to HIV. People who have HIV still struggle with stigma from communities. We have made a lot of progress, but it is still an issue. And it's not just for HIV, but even conditions like mental health conditions. Everyone deserves the opportunity to be cared for. Health is a basic human right for everyone. So it doesn't matter whether you have HIV or a mental health condition. We need the public, the communities to be sensitive and to give the support to these people. And thirdly, is around protection of our children through vaccination. As you know, every child in Ghana is expected to receive a range of vaccines early in childhood that will protect them against disease. It's the most cost-effective way to prevent disease, and it's cost efficient. So we are at a crossroads in Ghana because by 2030, Ghana will be graduating from external assistance from the Global Alliance for Vaccines and Immunization. They have contributed a lot to introducing new vaccines and also in sustaining the routine program. But because of the economic growth in countries like ours, we are supposed to start contributing and eventually exit from Gavi support. What does that mean? It means that, our children need to continue to be protected, but that means that we have to mobilize more domestic resources. And we would like to think about innovative ways of financing the immunization program. And that means that innovations locally, such as involvement of the private sector, and other potential donors locally to contribute to domestic resources that the government is putting in, that we are able to achieve that by 2030, so that we do not interrupt these very helpful protective vaccines that are causing improvements in livelihood and in longevity of life. So we are coming to you, Your Royal Highness, to see how we can, you can champion galvanizing the private sector to contribute to sustainable immunization services in Ghana. And we would like to work with you around an investment case for immunization so that this can be sustained. We believe through you, through the foundation that you lead, that we can galvanize all the goodwill and possibilities here in Ghana to sustain immunization services. These are our three asks, Your Royal Highness. I want to reaffirm WHO's commitment to working with the traditional leadership here in Ghana and to all stakeholders to achieve health for all Ghanaians. Please accept, Your Royal Highness, the assurances of our highest consideration. I thank you very much.
And I welcome you to my share today. There's no gainsaying the fact that the WHO has been doing so much in terms of health delivery and health security for the world. I know you went through some crisis in terms of funding, and therefore it got to a point where we weren't sure how WHO was going to be able to cover all its programs and all that. But it's heartening to see you here talking about WHO and what we can do together. It gives me the assurance that we still can trust WHO to be able to support governments in Africa and everywhere in terms of health delivery. There's no gainsaying the fact that health delivery is one major issue that can develop a country. We talk about economics and everything, but if the health delivery system is not working, people who can churn out the economy anyway, and therefore it goes hand in hand. It plays a major role. Budgetary allocations are also not enough for us here, and therefore I know they're doing so much that they can do, but it's not good enough for them to be able to do what can be done in relation to health delivery and health security. And that's why organizations like International we count on you. So standing here going through what you want me to do, I want to tell you that I'll be more than happy to support you. Join hands together to do HIV, maternal, all these things are happening. Unfortunately, at this stage, in the 21st century, when we have mothers dying when they're it's something that is worrying. We don't know why, but we have all the doctors more qualified. Is it because we don't have the equipment, or do they have the experience and we don't have the equipment? And if we don't have the equipment, what do we do? Rural areas also. Recently, just a few days ago, I read that we set up a small scooter ambulance or something for first aid chip compound. And I was told the joke was that we couldn't afford ambulances and we bought this. But that is also to mitigate against, in those villages where I'm told people ride on motorcycles to send patients, that was what is much better to mitigate against the pregnant women and people who are sick, that could be taken to the nearest compound or health facility. So we know that we encounter quite a lot. I was told, Otumfuo, for example, didn't have a cat lab. And I was made to be aware that if there was an issue about heart attack or something, or blockade, here in Kumasi, we would die because they wouldn't be able to do it. So we had to, now we're going to get about one here, then one in Olebu and one in the University of Ghana Medical School and all those things. So it's multifaceted. Multifaceted in terms of health delivery, which is more important. We are looking at a situation where a commitment from government to commit a certain percentage of GDP for health delivery. That would be something that would help in relation to health delivery. And also population. We also have to make sure that we know how the population is growing. Because if it doesn't relate to economics, and then people are giving birth, it is the responsibility of the Ghana to be able to look after their people. How many people do we have? How many people can we provide the health cover for and all those things? Insurance and all those things, health insurance and all those things are there. So there's so many issues that we need to look at in terms of how we can control. The 2030 is just around the corner. And all what we are bringing through, I don't think 4 years we can do it. We can't. But we still have to make the effort. I remember when we went to the UN and it was 2030, we should be able to move through. And I've been counting the years and they're still there around the corner. We still have not been able to put through all what we targeted to do. So here we are with the WHO, and then being prepared to be an advocate, to support as an organization, to support the doctors and the medical facilities. The responsibility is also on us also, as I sit here, to be able to come up with programs, initiate funding sources where we can use to support them. Private sector is another area that we can do, and I'm prepared to use my foundation for that so that we can. challenges are there. Governments will have money, especially in this era now, at this time where we are. In this whole world now, we don't know where we're going. There's confusion all over. So economies are not turning around. The economies are not going to turn around. Cost of living is going to go high. And it's going to affect health delivery. It's going to affect almost every sector.
Joe.
But that does not necessarily mean that we shouldn't be grateful. We have to make the effort. The challenge is ours. The people are ours. And I sit here and I have a responsibility. But governments will come and go and I'll still be here.
Joe.
And I have my people to look after. So if there was no hospital within the 4 years or 8 years of someone's presidency, the person leaves and I'm left with the people who are still sick.
Joe.
So the onus is on me also to support you to be able to do what we have to do. So I want to assure you that anything that we can do together jointly to be able to support health delivery, I'll be more than happy with any program that comes up to do it.
Joe.
Into the seats of the WHO, and then my sons here are here. We will all join hands together. Please let me know whatever it is that you think from here we can do. I will be more than happy to do it and initiate and then make sure that we go ahead with all these programs to make it more fruitful and beneficial to our people.
Joe. Yeah, done. Otumfuo ase. So for my now.
Thank you so much.